So there it is. Okay, that is the official start. That's like the gun to start the races. So we just got some slides we're going to bring on. I'm going to share my screen here and kind of walk you through some of the content. And again, thoroughly encourage Q&A. That's really why we're doing this. Big thought is to have interaction. So we're hoping that this is not just a bunch of me talking for the next 20 minutes and then silence at the end. So just a high level of kind of what we plan to talk about, really just the basics of Medicare 101, what it is, who it's for, that sort of thing. We'll definitely be talking about Part D, as many of you know that are already on Medicare. This is one of the big primary reasons why the fourth quarter of the year gets hectic. And we'll also kind of dive a little bit into the differences between Medicare Advantage as well as Medicare Supplements. For a lot of folks on the peninsula, Medicare Supplements is a subject that they are well versed in, but Advantage has kind of come and gone, and we'll go over the history of that a little bit and maybe even talk a little bit about who it's right for and does it make sense. So we'll move it along. Basics of Medicare. This is really for any of you who are attending and watching who, you know, aren't already on Medicare. This will be good. For those of you who are a seasoned veteran, well past the age of 65, this will just be a refresh. Basic Medicare coverage is provided by the federal government. So what we do is Medicare insurance, but there is a basic coverage that some people decide to go with solely. And so basic Medicare, as you'll know with Medicare, they love the letters. For whatever reason, they didn't want to simplify it with, you know, plan types or names. They go everything by letters. So parts A and B are really kind of the entry in the door. For most folks, this is the basic insurance. The minute you turn 65, this is what you'll be getting. And in reality, it covers 80% of the cost. So, you know, a lot of traditional insurance before you're 65, you pay for an insurance policy that helps cover 80% of the cost. So this is very similar. For most folks that are turning 65, if you are already taking Social Security, the federal government will take their cut immediately. They will not wait. They will not ask you to pass go. The first paycheck that you get in Social Security, they will take your premium. So basic Medicare does have a cost, about $150. As with everything in life, that does tick up and change. So the $148.50 is the base price for 2021. They haven't announced if and what the new changes will be for 2022, but we've historically seen it tick up anywhere from $3 to $5-ish. So we're just going to say about $150. That's kind of the base price for Medicare. 80-20, it's okay, but a lot of people realize being on the hook for 20% of something large could be a big deal. So, you know, if you're going to have the sniffles and go see the doctor one time, 20% of that bill, pretty minimal. You're not going to be put out, you know, of house and home. If you have a heart attack and have open heart surgery, 20% of that bill could start ratcheting it up, as well as MRIs and other procedures. As we're all aware, the ever inflating costs of medical processes, that 20% leaves people wanting for more peace of mind protection. And that is where the private insurance market comes in. That's us, Castell Insurance. So there are options for add-ons. We talked about it at the beginning, the home screen. We're all used to Medicare Supplements, Medicare Advantage, and Medicare Part D. You will see tons and tons of TV ads, mailers, everything that you can find, any way that people can get a hold of you. Gosh, even the internet, click here, and God forbid you enter your phone number. As we talked to a client yesterday, you'll quickly get 20 phone calls. So obviously soliciting our services as the local go-to that you guys come to, because you can call us and you don't have to put your information out on the internet for everyone to reach out and solicit. Medicare open enrollment, that's what we're just about coming up on. That is every single year from October 15th through December 7th. So that'll be on the next slide that we cover. But most plans, the prescription drug Part D, as well as Medicare Advantage, are subject to open enrollment. So what that means is the only time of year that you can change your plan is that 7-week period. You have 7 weeks, which for you seems like an eternity. For us who want to help as many people as possible, 7 weeks to help as many people in our community that want our services, that time gets condensed. So that's why we try to do these things to educate you in advance. So this is a 7-week time period each and every year, whether you've been diagnosed with cancer or you are now cancer-free and not taking drugs, or you're going to have knee surgery. These are the time of year that you can change several of your plan options. Again, thoroughly encourage. I don't have the chat up, but as things come up, if you guys have questions, punch them into the chat. We'll get there. This will try to be hopefully only about a 15-minute presentation and get to the finish line where we're really anticipating having some good back and forth conversation. The big elephant in the room this time of year, which affects a majority of folks on Medicare, is called Part D. We always liken and remember this as D for drugs, because this is your prescription drug policy. This is subject to the annual enrollment period. You'll see down here at the bottom, subject to the annual enrollment period of October 15th through December 7th. So every year you have the opportunity to shop and review your plan. And we thoroughly encourage this because every year, 2 things could have happened. Number one, you could have changed. Maybe you've got a new prescription that was given to you mid-year, and you want to find out if there's a better option for you. But number two, what many of you may have seen from us in the past, if it's not you changing, it's very likely your insurance carrier is changing. You've seen changes of names, conglomerations, Aetna by SilverScript. So, they just change. It seems like every 3 years, something big is changing. It could also be that the cost of your plan or the cost of your drugs is going up. This year, we sent out a specific email. We had a small group of people that were getting a $40 a month increase. Seems egregious, but it also changed their coverage a lot. They were getting the deductible paid for. So for folks with high cost drugs, it's not that bad of a deal, but we just want to make sure that you are paying attention that this open enrollment period for Medicare Part D is super serious. And so that's a lot of the reason why most of you will be on this today. One key part that we talk about with several people year in and year out, Part D, I don't know how I would term it. Phil maybe will have an answer for this later, but it's not exactly required, but it's thoroughly encouraged. The government incentivizes you, as maybe you've heard this example. There's 2 ways to get a behavior. It's the carrot and the stick, right? So the carrot is how can they give you a reward for getting Part D? The federal government uses the stick. So this is if you decide, hey, I'm 65, totally healthy, don't take any drugs. I don't need a drug plan. I don't want to pay, for a policy I'm never going to use. Well, every year that you go without a drug plan, you will incur a penalty, which grows year in and year out. So for example, if you were to go, let's say 5 years, you wait till 70 and you start getting some more ailments and you want prescription coverage, you've now incurred 5 years worth of a drug penalty. The downside to that, and this is where that big stick comes in for motivation, that penalty never goes away. So in today's terms, you're looking at about $4 for every year that you've not had coverage. So you're roughly looking at maybe about $20 a month extra at 70 years old for every month for the rest of your life. So that penalty does grow to be really kind of steep enough that at some point in time, if you go 10 years without a prescription drug policy, that ship may have sailed. So although it's not encouraged or not required, it's thoroughly encouraged. And there are some really inexpensive drug plans, less than $10 a month, that kind of check the box. You're playing in the game. It shows the Medicare federal government that you're a participant, but you're getting the cheapest, most bare bones coverage until you really need to see it. That said, shopping it every year is super important. We've sent out in our newsletter, which is probably how you're here, we have how to shop Medicare Part D tutorials. We have our own website called clallampartd.com. Super easy to go in and enter your zip code, your prescriptions, your preferred pharmacy, and then it gets you to the finish line. It will pre-populate and calculate and say, we believe plan X is the best based on your prescriptions. So although you can only change.
Something there, James?
Yes.
Okay, great. All I wanted to say here is we go on and let people know the dates are October 15th through December the 7th. However, the Clallam Part D site is live and uploaded with the 2022 programs now. So you can go on the website now, you can play around, enter the drugs, you can see if you can save money changing a different pharmacy maybe. You can play around as much as you like in a sandbox. You just cannot actually buy a program or click on purchase until October the 15th. So don't think you need to wait until October the 15th to start shopping and doing your homework. You've got another week from now where you can get a head start on everyone else and start looking and getting questions answered before the site can actually be purchased. So go ahead and have fun, and we'll help you any way we can.
And you guys can jot this one down, Clallam Part D. It was also in the newsletter. And also, if you forget this somehow, I'll show you. If you go to our website here, castellinsurance.com, pretty simple. Hey, look at this, dead center right in the middle. You will see Clallam Part D. It's also up at the top. So we're doing our best to make sure to get this information to you any which way. And if you're still having troubles, call our office. We'll send you an email with the direct link. But it is there. It is easy to use. We have a tutorial led by Phil Castell walking you through it. And over the last couple of years, we've had over 1,000 people utilize the site to review and change drug plans. So we know it's working. We know it's new, but hey, so is Zoom webinars for us, but we're all struggling through it. So we're going to move along to kind of another subject that most people know of in the peninsula. This is kind of the not required, but this is what a lot of people like to do to protect their peace of mind. Add coverage for traditional Medicare. So this is the 20% gap that we were talking about at the onset. This is where folks want some sort of peace of mind to be able to go to doctors, hospital, surgeries without having to foot a large portion of the bill. It's called the Medicare Supplement, and it's called Supplement because it does exactly that. It supplements traditional Medicare. So you are still Medicare first. When you are a Medicare Supplement client, you would have Medicare paying their portion of the bills, and then you'd have a private insurance carrier. Many of you know the names of Regence Blue Shield, United Healthcare, Mutual of Omaha, Cigna, Humana, all of the big private companies. This is a frothy water of competition. There's a lot of people out there. We're appointed with just about everyone to help. But this is where you have one layer, which is Medicare picking up 80% of the bills. And then you have your supplement, which picks up the other 20%. Now, there are different plans. Go figure. As I mentioned, Medicare loves the alphabet. So they have different plans to kind of accommodate different budgets and really different health situations. The majority of our plans that we work with is really very simple. We consider it good, better, best. So Plan N, a great plan for folks that are relatively healthy, don't go to the doctors very often, and also don't mind the occasional copayment. Copays, if you're aging into 65, man, you're used to it, because us that are under 65, you pay an arm and a leg for anything. It seems like you're going to have a cost share for any sort of procedure or doctor's visit. With Plan N, the simple way it works is you would pay the Medicare deductible, which as of today, again, disclaimer, we don't know what next year will be, but plan on about a $5 increase. As of today's plan, it's $203. So if you were a Plan N patient, at the beginning of the year, you're going to pay the first $203. And then after you've met your deductible, then you're going to pay $20 copays. So you go into the doctor, mid-year for something, you expect a $20 copay. A little change of this over the last few years, some of you may have seen, is a lot of providers are no longer charging for every single visit. They do something called batched billing, where they may, if you're a frequent flyer and you're racking up 3-4 copays in any month, they will batch those per quarter, per every other month. So you may get a flat bill for $80, and that would be 4 visits. This type of plan, you're looking at about $145 a month as the addition to your Medicare. So remember, going back to slide 1, Medicare is about $150. So you're looking at about another $145 a month. Plan G, this is the better. This is the silver, but I'll give you a caveat as to why, in my mind, it's the gold. Plan G, you pay the same deductible. So you pay the same $203 deductible. And after you've met that deductible, no copays. So for folks that are doing physical therapy or having a surgery or, going to be a frequent flyer based on certain things, Plan G is a really good way to just cut out the headache and hassle and ratchet it up copays. Plan F is a plan which is the Cadillac plan, the Platinum, the best of the best. It is no longer available for new enrollees. So for anyone that is just watching this, getting ready to turn 65, Plan F is no longer available to sign up for. So only the folks that were already 65 as of 2 years ago are eligible for the plan. They'll always be eligible. But what we've seen is this price, because it is no longer adding in new clients, that price is climbing at a disproportionate rate. So as every plan goes up $3 or $4 or $5 every year, Plan F is going up higher because they're not adding younger, healthier folks. The reason people have loved Plan F in the past: no deductible, no copay, no extra bills. You pay your premium and the insurance company picks up everything. So it is a great plan for folks that aren't budget conscious and just want simplicity. Man, Plan F, it's hard to argue with, but for a lot of folks, what they start to do is crunch the numbers and realize that the difference between Plan F and Plan G is just this small deductible. And when you start punching the numbers in, you'll find out that Plan G is actually, over an annual basis, a better value. But again, that's what we're here for, to help weigh your decisions. If you think Plan F or G might be best for you, obviously, selfish plug here, contact Phil, John, or I. We can go through kind of the equation for you and see what's good. The other thing down here at the bottom, this is a big one. I mentioned which plans are eligible or subject to the open enrollment period. Medicare supplements in the state of Washington. So disclaimer, in the state of Washington, Medicare supplements are not subject to open enrollment. What that means for you as an individual is you can change your supplement plan any time of the year. And for many of you, you will have seen that we help navigate these waters for you when we see the opportunity to really net you a good savings. For example, a lot of the companies we deal with, they change their premiums as of April 1st. So it wouldn't be fair to sucker you in now during open enrollment at this price, and then they go to like 180. You have to have the chance as a consumer to change if they're going to change. So this is a big one that a lot of people are unaware of. Supplements can and really should be reviewed throughout the year, not just during open enrollment. We talked about Part D is definitely open enrollment. We're going to move on to the next subject, which is newer to the peninsula, and that is Medicare Advantage.
James, can I say something before you move on?
Yeah.
One last thing that needs to be noted about Medicare supplements is they are standardized. Plan N with Omaha, Plan N with Regents, Plan N with AARP are the exact same plan. It does not matter which company sells them. It's the exact same set of benefits. That's why it's, as James said, necessary to look at it, because if you're on a AARP, Medicare Supplement Plan N, for $173, we have other options that are less expensive. And you've been on that for a while because we sold it to you 4, 5, 6 years ago. So this is important to understand. It does not matter which company you have. If you like the benefits of N, we can keep you in a low priced program that will meet your budgetary needs.
Awesome. Thank you. And as I read the slide here, another benefit that I forgot to mention over here on, excuse me, working through the kinks on round one here, guys. Another benefit of going the supplement route for your additional coverage is nationwide coverage. So, Medicare is a nationwide payer. Basically every doctor in the country accepts it. And so therefore your supplement can go with you. So as you travel, as you hop in the RV or you go visit the grandkids, you can have peace of mind that your insurance will go with you in the event you need services. We're going to move to the next subject, which is near and dear to some hearts, and that is Medicare Advantage. And Medicare Advantage is a little bit different. We'll go over the pros and cons. Medicare Advantage has been, I'll give you a history back lesson here before we jump in. Medicare Advantage, you'll see these commercials all over the place. You'll see Joe Namath, as John likes to joke, talking about bringing you meals and rubbing your feet. You will see a lot of these advertised and a lot of great benefits that they try to rope you in with certain perks like dental and vision and hearing. And those are all true and good. A lot of the commercials you will see are not available in Clallam County. So insurance, although you may be watching a Seattle TV network, it may not be available in Clallam County, and we'll let you know what is. But Medicare Advantage is kind of a fundamental shift from the Medicare Supplement. If you guys will recall, Medicare supplements, they stack on top of your traditional Medicare. So you have Medicare as your primary, and then you have your supplement. With Medicare Advantage, you're signing away to be insured by a private insurer. So you are shifting from kind of the two-payer, Medicare and private company, you're shifting to one. So you have one company that will be covering all of your insurance needs. So not totally different than how it is when you're under 65. Myself, in my 30s, I have a insurance policy that covers everything, and it's with one company, and I'm subject to their network, their deductibles, their coverage. So Medicare Advantage is really similar to the things that you were used to before going to 65. The benefits and the pros and cons, as you can see, we made a little chart here. Pros of a Medicare Advantage program. And again, a Q&A will be a great spot to say who's it good for. But pros of a Medicare Advantage program, you're going to see substantially lower premiums. So you'll see some advertised as $0. I know in the Peninsula area, we have a plan around $30 a month. So going back, as opposed to the Medicare supplements of $140, $150 a month for Plan N, you're looking at $30. So right off the bat, a huge savings on your monthly premiums. Pro, like obviously pro right there, you're saving money. Pro is added benefits. They may be able to offer you things like dental, vision, hearing, sometimes gym discounts. We've seen reimbursement cards. Like every plan is different. So again, shout out and plug to us, contact us for a one-on-one consult to find out what's available in your area, because being live on Zoom, we may have people outside of Clallam County and you'll have different options. So added benefits above and beyond what Medicare covers, because as we all know, Medicare doesn't cover dental. We've heard about that in the news as of the last month, but your Advantage plan may. And another pro, it's a simple all-in-one. You don't have to worry about which insurance card you have. Oh, do I give them my Part D from this company, or my, who pays for what? This simplicity, it's all in one, everything with one carrier, one bill, one invoice, one set of benefits. So there are a lot of pros. Now, with every T chart, as I'm looking at, for all my accounting nerds out there like me, you'll see there's got to be cons. There's got to be a side of trade-offs. So some of those trade-offs, a smaller network. There's no way around this. Medicare Advantage, although many providers have big networks, it's never going to be as big as Medicare. Medicare, as I mentioned, nationwide. I think it's like 99.899% of doctors and hospitals accept Medicare. Won't be the same with, a Medicare Advantage. We have some advantages in the area that cover over 30 states. So you've got travel options, but it will just never be as bulletproof a network as Medicare. But for a lot of people, when you look into the details, that may still be okay. Some of the other cons, higher copays. This is a direct trade-off. So when you have low premiums, there's going to be a trade-off. So if you're paying low monthly, it's kind of pay now or pay later with most insurance products. So higher copays in the shape of, if you need to go to the, specialist, maybe it's $50 instead of that Plan N $20. If you need a blood draw, maybe you pay $30 for an x-ray or something. I'm just using example dollar amounts. We're not talking tens of thousands or anything crazy or exotic, but since you're paying a lower monthly amount, you can expect that the trade-off will be, if and when you use it, you're going to pay a little bit higher on the entry fee for all of your services. Additional con, you're stuck to open enrollment. So it's, in my mind, it's not that different than being under 65. You can't change policies mid-year. So if you have a knee surgery that you didn't anticipate, you're healthy in November, you sign up for an Advantage plan, and then you find out, oh, I tore my ACL, I have to go have knee surgery. You can't change your plan. You can't go, man, I'd really like to have a lower hospital copay or lower, like, you're stuck in the plan for 1 year. But that doesn't mean you're stuck forever. You can always go back to traditional Medicare. So just like I'm going to go back a screen to traditional Medicare, if you are on a Medicare Advantage, you will have options to go back to traditional Medicare. So it's not like leaving permanently. You're just subject to that open enrollment period. So you can see great benefits obviously come with some trade-offs. And, you know, it's more of a nuanced conversation to talk about. What are your plans for traveling? What are your finances like? You know, if you could stomach a $800 bill if you had a surgery, is that going to shock you? Maybe going with a more kind of level premium plan would make sense. So a lot of nuance to Medicare. That's why year in and year out, we see so many people with questions, concerns about changes, information. You are now in open enrollment, which is kind of a fork in the road, as you can see here. Am I proud of this graphic or what, you guys? This shows that you kind of have two, you know, choose your own adventure. Luckily, these roads, you can come back and switch and flip flop in between as you see fit. But we are kind of at the point now where we've gone really, really high level. I'm going to unmute if I can figure all this out. I'm going to allow you all to unmute yourself. So Phil, John, I'm going to be opening up the floor to questions, but I would like to answer or ask the first one here. Where do we go and how do we find out what the best Part D program is for us?
Well, I answered first last time, so should we let John do this?
So go ahead, Phil. Go ahead.
Go to ClallamPartD.com. There are other websites out there. Medicare.gov lists all the carriers. With the ClallamPartD.com, we are showing you all the carriers or all the insurance policies that will work with agents such as ourselves, where if you have questions and need help throughout the year, you can call our local office and we can give you help and advice over the phone. If you go on the Medicare.gov, we've got no record of that. We would not be compensated. We'd know nothing about the program, and we wouldn't be able to help you. So if local support and service is important to you, we do strongly recommend you use the Clallam Part D website.
Thank you for that. Anyone that is currently muted have any questions that they would like to ask? I see so far I must have done such a great job on the presentation because I see 0 questions in the chat feature. So either everyone has likely muted us at this point or have no questions. I see one coming in here. Do we work with people in Jefferson County? The answer simply, I'm going to hop on that one. Yes, we're licensed throughout the entire state of Washington. We called it Clallam Part D because our company is located in Clallam County, and a majority of our clients, roughly 85% of them, reside in Clallam County, but we do have Jefferson, King, Pierce, Snohomish, you name it. We can help anywhere. The site that Phil mentioned of ClallamPartD.com is good for anywhere in the state. You will enter your zip code and it will show you plans for anywhere in the state. It is not just for Clallam County residents. It works for anyone. So yes, we work with, and so does our site, will work with anyone in the whole state.
Hey, Jim, I'll take this next one. So Mary, in Clallam County and Jefferson, we have Regents Blue Shield as the primary. There is one other company, but their network is listed to or limited to Clallam Bay and Forks. So unless you want to drive out to sunny Forks to get your doctoring done, Regents Blue Shield is where we go. They have 2 programs. Actually, they have 3 programs. A 0 premium, which is specifically really to people who have
John,
VA benefits.
John, We shouldn't be going into premiums really on this.
Okay,
It's
all
just a
right.
matter of let people reach out to us if they want more
Okay,
specific.
all right.
So we just want to say the primary carrier, that covers the whole of Jefferson as well as Clallam. For Med Advantage is Regions Blue
Is
Shield.
Regions Blue Shield.
And
Okay.
I'll just jump in here for everyone. Unfortunately, as much as we would love to give you guys every bit of information, Medicare or CMS, Center for Medicare Services, they have some very, very strict rules about solicitation. Unfortunately, not every agent or agency is honest and upstanding, and they do stuff to twist people into certain policies or do stuff. And for protecting our aging community, Medicare governs us very strictly. So we have things that we can't say on, mass presentations like this. We can, when you call into our office, dive into the details because we're doing a one-on-one consult with you then. But when it comes to mass communications, certain things we can and can't answer. So if we plead the fifth, it's not because we are ignorant or don't know the answer. It's because we are so smart, we don't want to get slapped and penalized by Medicare. I had a question on here. If you want to change your Medicare supplement, yeah, you can call or email the office. We'll be able to do that. Those are pretty simple switches. For current clients, very easy because we already have most of your information. But yes, that can change now. So there's no reason if you're ready to move or look at different options, that is available now.
I'll take the next question, James.
Yes.
If you're happy with your Medicare Advantage program, do nothing. It will automatically roll over year after year. The same for your supplement and your drug programs. But with the drug programs, we still recommend you change. Now, we do have a question from Betty regarding working past age 65 and keeping employer coverage. You can opt out of Part B or you don't enroll in Part B. There'll be no penalty provided you do have creditable coverage, and that will also follow over for the Part B drug program. So if you're working past age 65 and your employer has more than 25 employees, you're considered covered with creditable coverage. So when you do retire at 66, 67, 68, whatever age, you can then opt in for Medicare Part B and Part D for your drug program without any penalty. Also, you can do that at any time of year. So just because you didn't enroll in October through December, if you retire in June, you can sign up for Medicare Part B and a drug program in June or July without any problem at all. Yes, Jamestown works with the Med Advantage programs. Sorry, I didn't mean to hug the microphone there, James.
We have another question that came in a little bit earlier in the feed. Where can I find the 2022 drug formularies for each Part D provider?
So my suggestion there is if you go to ClallamPartD.com, you enter your medications into the program, you enter your preferred pharmacy, it will then show you the program most suitable based upon the information you've entered. When you look at the list, you can click on plan details, and when you scroll down on the plan details, there will be a place that says show plan formulary. Now, the formularies that I'm seeing are usually between 80 and 130 pages long. And if you want to open that and save it as a PDF on your desktop or on your iPad or however you do that, you can save the whole formulary as well. If you wanted the formulary from every carrier out there, just click on every plan available and download their formularies as you go along. But that seems like a lot of work when the computer will do the work for you and sort through all the different programs available to find appropriate ones.
So James, I'll take this next one. Medicare Advantage is the only Medicare program that covers naturopathic doctors. That is correct. It's one of the added benefits that Medicare Advantage includes. Medicare Advantage also covers acupuncture, which, even though it's been around for 3,000 years, Medicare doesn't know if it works. But yes, if your naturopathic doctor is in the network, and again, this goes back to networks versus Medicare. If the naturopathic doctor is a MD and they accept Medicare, you can see them. But right now, as far as I know, the naturopathic doctors on the peninsula are covered under the Medicare Advantage plan.
And in fact, that was Linda, Dr. Linda Milos, who is a naturopathic doctor. And so thank you very much for joining us, Linda. And we're glad that you are part of the Regions Network, and we hope more people come and see you.
So that's, again, like John mentioned, one of those added perks that the Advantage program does offer. As we mentioned, a lot of the times you will see on TV with dental and vision and hearing services, they hammer those home because those are specific things that are not covered by Medicare. So what they're trying to do is raise the white flag of attention going, hey guys, hey, it's basically the person with the taxes done here sign going, look what we can do, look what we can do. It's a way that they are trying to get attention, and naturopath acupuncture is a huge benefit that most Advantage plans cover, not all, but most. As you see, I'm narrowly dodging that fine line of what we can definitively say on a mass communication and not. And I see a question here about, this is kind of one of those one-offs. Knee surgery, we would suggest, again, that's probably a one-on-one consult to weigh the pros and cons of premium versus out-of-pocket expenses on an Advantage, depending which plan you're on. That is where we get a little bit more specific, and don't want to give you mass advice on this sort of thing. So Tim, I think John mentioned, give the office a call, but we're happy to kind of go over pros and cons of those. We have another question in here, Phil, if you can answer, specific plans that cover any mental health therapy.
So generally that is an area Medicare, traditional Medicare does not cover very well. The Advantage programs do cover a certain amount, and they also cover chemical dependency counseling and different forms of counseling as well. So if counseling is important, let us know, because that is something we can look at the outline of coverage, where we've got a lot more details and are readily available to show people definitions and terms. So if that's important to you, that's more of a one-on-one conversation where we can share information privately with you.
And that's a great question, because I know that, as well as like Teladoc has been coming up a lot more, and all of those are based on the actual plan and based on Medicare's rules and regulations. We cannot really, I listened to some podcasts, we cannot give financial advice on this. Everything is general, and there's some disclaimer we should probably be reading. But basically, if you want specific finite details, as you can see, we're doing our best to be available. You can call now. All of these questions, we can talk, we can hash it out all before October 15th. We do not have to wait till today. In fact, if you're on this and you have questions, I would encourage, the minute I end this, call the office, because come October 15th, our time, as I mentioned, the 7 weeks to talk to everyone, time gets condensed like crazy. They're just not making any more of it, unfortunately. But right now, Phil, John, and I have a little bit more flexibility because we can't actually process or do anything. So right now is a good time to ask those general questions about your situation. You're doing the homework, you're laying the foundation for when the 15th comes, we can, be ready to pull the trigger on what we want to do. So unless anyone else would like to type any questions, or if anyone wants to unmute themselves and join just so they can be part of our what a historic moment, our very first online webinar. If anyone else has any questions, type them in. Otherwise, your silence will be my permission to end the meeting in the next 5 seconds.
our inaugural Zoom presentation.
The first of several. So if you missed this, or you had anyone else that you thought that this might be beneficial, we will be doing the same thing tomorrow at 10 a.m. We'll be doing it next week, Tuesday at 2 p.m. The links are out there. So if you thought it was beneficial, or you run into someone at, the dog park or at Bridge Club or whatever it is that you're doing, and you thought, hey, this is worthwhile information to share, we'd love to help. They don't have to be clients. The links are on our website. And Phil, I can see you're chomping at the bit to say one last
because
thing.
We had another question. Okay. That was John answered the question from David. So,
and again, that one, the question that was typed in, plans that cover dental, vision, and hearing. Again, those I can tell you are not covered by traditional Medicare. So it may be something through Medicare Advantage. And again, we would help you weigh and balance the pros and cons, that T-chart that we made. We do that with everyone to understand your individual circumstance.
However, one thing I will say, James, I'm a bit of a numbers nerd. I don't know if people know that about me. And in the state of Washington, 41% of all Medicare eligible people are on an Advantage program. In Clarence County, because we've only had the program for the last 2 years, because they went away for 5 years, right now the number is we're only at about 7% of Medicare people on an Advantage program. So we think that as the programs get better and they gain greater acceptance and people are aware of them, more people will give it a try. So we're just here to help any way we can do. We were a little hesitant the first year to put an awful lot of people on it because we wanted to see how the programs would work and how the providers liked the programs. We've had very, very good response. In full disclosure, we've heard a little bit of sometimes needing to get prior authorization more on an Advantage program than with traditional Medicare, but those we've heard of being few and far between.
And what I can tell you, just from my point of view, when you come to us, I think most of you will know there's no additional cost, no fees. You're going to pay what you're going to pay, whether you go it alone or with our guidance. And it is our number one priority to make sure that you are happy and in the right plan. So when people ask, oh, have you had any complaints? Have you had any things? Really, no, because we do a really in-depth job to make sure we're not just wham, bam, thank you, ma'am. We make sure that we're talking through your individual circumstance. So that way, there's going to be no buyer's remorse. There's going to be no sticker shock or I didn't understand. Taking the 30 to 45 minutes to talk through the plan options with us. And really, that's about what it takes. You're going to be really well educated. We're going to not have any surprise calls come, February. What? I didn't know this. So out of the, hundreds of people that we've helped with Advantage, we haven't had any major complaints because people understand at full length what they're getting into because it does work for a lot of people.
But in closing, I'd just like to say, whether you're on an Advantage program or on a supplement, make sure you know how your program is going to cover your drugs for the following year, because that is where people get bit in the backside. Every year in January, February, we get people calling, my medication's not covered, they covered it last year. And we're doing everything we can do to get the message out there. Please, please, please read those notices you get in the mail. Lady who asked about the formularies, double check the formularies. Make sure you know what you're going to have for the following year. That's it from me, folks.
Well, I think everyone's had their opportunity to tap in with questions. We got it done in less than an hour. How does Good RX compare to Part D coverage? Phil, I'll let you jump on that. And maybe could you just for a quick second explain what Good RX is before you compare about it?
Yeah. GoodRx is actually a website and an app that people can have on the phone. It is not insurance. And what people can do is if they take a medication that may not be covered by the Part D program, they can go to GoodRx, and I have it on my phone, and you can enter the medication in. and your zip code, and it'll show you the price that medication would cost at the local stores. You can go to the store, show them your phone, and they'll write a code off the phone, and you'll get that discounted price. Just like that. Correct. So the nice thing with GoodRx is it's not insurance, but therefore with it not being insurance, if you don't have a Part D program, you'd still be incurring a penalty. So frequently people will use both. They'll have a Part D program, and depending on the situation, the GoodRx may be more advantageous on occasion. However, if they use the GoodRx, the premium or the price you pay for the drugs does not count towards your deductible out-of-pocket max on the Part D program. So if you've got a Part D program and you think you're better off using the GoodRx, please take a couple of minutes to talk to John, James, or I, and we'll go over and explain what you're doing and if it's right for you. So please use our services. That's what we like to help. The Washington Prescription Drug Program is also another tool that people can use. Similar to GoodRx, you get a discounted price. It does not count as insurance. So if you go without Part D, you'll still have the penalty. Whatever you pay doesn't count towards deductibles, blah, 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 blah. So they're not insurance. So we've got Part D for insurance, you've got GoodRx, you've got the Washington Prescription Drug Program. You get ones from some insurance companies will send you one, AAA will give you a discount drug card. Those discount cards are that, it's a discount, and right on the cards it will say, this is not insurance.
One last thing, Phil, that goes for Canada Drugs Online for people that buy their drugs in Canada. It's the same thing. You need to look at what the cost of the Canadian drugs are, because quite often they are as inexpensive as your normal cost of your medications. And then when you go in the donut hole, they are actually more expensive because they have fixed the donut hole and the coverage gap, so it's less. But those, again, do not apply to your deductible or to your out-of-pocket.
All right. Well, it's been very informative. Phil and John, I think it should be our 3 mugs on here. And since this was our inaugural, I'm going to take a quick screenshot. So give me your best happy face so we can commemorate this moment. Awesome. Well, thank you guys for joining. Photo was taken, and I think we've done you justice. Again, last solicitation. Call the office if you have questions. That's what we're still here for, doing everything to educate you guys on what options are there, what's changing, what's right for you. It's what we do. It's what we love to do. As you can see, we are insurance nerds that even get custom-made t-shirts made. So we look forward to helping you, your friends and family, and the rest of the community. All right.
Sounds good. Thank you.
Bye, guys.